As we know that about 85% of breast cancers occur in women who have no family history. Knowing the modifiable factors which increase the risk of developing breast cancer becomes very pertinent. Why? Because we know the first A, that is aware, we can go to the subsequent A's, that is avoid and assess, and be more inclined to activate BP, that is Brahm's protocol. I will be discussing the modifiable risk factors, what they are, and how they increase our risk of developing breast cancer in detail. Still, if there is any aspect in which you need more clarification, please write in the comment box. I will discuss them subsequently. One of the most important risk factor is increased estrogen hormone exposure. You must have heard this so many times. Estrogen, estrogen, estrogen. What is estrogen? In plain, simple words, estrogen is a chemical produced by the body that is responsible for making a girl develop into a woman. That is, all that is feminine is because of estrogen. Just for example, such as development and enlargement of the breast, which is a part of the normal process of attaining puberty. This change in the body of a girl is brought about by this chemical, which is also known as hormone estrogen. Okay, so this is a hormone. The chemicals that are produced by our glands are called as hormones, and estrogen is a female sex hormone and it is produced by the ovary. Now, estrogen is a double-edged sword. Within the normal limits, it is beneficial for the body, but excess of this hormone increases the risk of developing breast cancer. So please remember, estrogen is one of the biggest culprits. Therefore, any condition that results in an increase in the amount of lifetime exposure to estrogen in the body increases the risk of breast cancer. Now, what are these factors? Among the most significant factors are actual life events which increase the risk. And I start with the young premenopausal woman. First factor, early age at menarche. That is, a girl gets her first menstrual cycle before the age of 12 years. Usually, the menses starts after 12 years. If it develops before that, it's a risk factor, and you'll be surprised to know that studies have shown that for each year that menarche is delayed beyond 12 years, it has been found that there appears to be a 20% decrease in the risk of breast cancer, which is very significant. Second factor, late age at first full-term pregnancy. That is, over the age of 30 years, results in 2 to 5-fold increased risk in comparison with a woman who had a full-term early pregnancy. The question that must be coming to your mind is, how does pregnancy, and more specifically early pregnancy, protect us from breast cancer? Actually, it's very simple. Pregnancy, and since I'm talking about pregnancy, the breastfeeding has a similar mechanism. So both of them reduce a woman's lifetime number of menstrual cycles, as during pregnancy there are no menstrual cycles, and similarly during breastfeeding. And with each decrease in the number of menstrual cycles, there is a decrease in exposure to estrogen. Thus, her cumulative exposure to estrogen and progesterone, which is another steroid hormone, decreases, thereby causing a decrease in the breast cancer risk. In addition, pregnancy and breastfeeding also have direct effects on breast cells. It causes them to differentiate. Differentiate means that they become more mature to function in different manner, more mature cells. So they can produce, for example, milk. Some researchers say that these mature cells are more resistant to get transformed into cancer cells than cells that have not undergone maturation. Also, recent studies have shown that early pregnancy decreases the proportion of the hormone receptor positive cells in the breast and causes pronounced changes even in gene expression of breast cells, protecting them from cancer. Very important, isn't it? As late age at first pregnancy increases, the risk increases. Similarly, in contrast to this, there are few pregnancy-related factors which are associated with a lower risk of breast cancer. So you should know both. What factors? If late pregnancy, late menarche. Now, what is the factor which can protect, which is associated with pregnancy? Early age at first full-term pregnancy. Now, early age, what do you mean by early age? That's a very pertinent question, but whatever the studies have been used, which have found that pregnancy decreases the risk of breast cancer, they have said before 20 years of age. Women who have their first full-term pregnancy at an early age have a decreased risk of developing breast cancer. That is before 20 years. But this is practically not possible in today's world. Which lady will have a pregnancy before 20 years of age? The risk of developing breast cancer is said is about half the women whose first full-term pregnancy occurs after the age of 30. Sounds very nice, but it is not practical. It is all theoretical. So basically, I would like to tell you that the carry-home message for this would be: try to complete your first pregnancy before the age of 30 years. Okay, so your first pregnancy must be complete before the age of 30 years. Okay, now this risk reduction is limited to hormone receptor positive, also called ER, that is estrogen receptor positive breast cancer. This is a subtype of breast cancer. When I will discuss the types of breast cancer, I will explain them to you. But please understand that pregnancy decreases the risk of hormone receptor positive, that is ER positive breast cancer, which is also the most common type of breast cancer. Nearly 80% of breast cancers are ER positive. So it has a very important role. The other factor, increasing number of births. Very interesting data. The risk of breast cancer declines with the number of children born. In a study, it was found that women who gave birth to 5 or more children, 5 or more, had half the breast cancer risk of women who have not given birth, which obviously in today's scenario is not possible to have 5 children. But this actually gives us the explanation why in the good old days the incidence of breast cancer among women was less, because every mother was having at least 5 to 7 children. Another aspect, since we are talking about pregnancy, is a history of preeclampsia. Women who have had preeclampsia may have a decreased risk of developing breast cancer. Now, what is preeclampsia? Preeclampsia is a complication of pregnancy in which a woman, when she is pregnant, develops high blood pressure and excess amounts of protein in her urine. Scientists are studying whether certain hormones and proteins which are associated with preeclampsia may affect breast cancer. We do not know what are the factors which are playing in this, but if we know that, then we probably will be able to do something about the incidence of breast cancer. Now, since we are discussing pregnancy and breast cancer, let me also answer the question: is abortion linked to breast cancer risk? This is again a very question was asked very frequently. See, a few earlier studies in the mid-1990s suggested that induced abortion, that is deliberate ending of a pregnancy, was associated with an increased risk of breast cancer. However, recent studies have consistently shown no association between induced abortion and breast cancer risk, and the major findings from these studies include: number 1, women who have had an induced abortion have the same risk of breast cancer as other women. Number 2, women who have had a spontaneous abortion, that is a miscarriage, have the same risk of breast cancer as other women. Number 3, cancers other than breast cancer also appear to be unrelated to history of induced or spontaneous abortion. Another question that is related to pregnancy: does fertility treatment affect the risk of breast cancers? Women who have difficulty becoming pregnant or carry a pregnancy to term may receive fertility treatment. Such treatment can include surgery or medications to stimulate ovulation and assisted reproductive technology. Ovarian stimulation and some assisted reproductive technologies involve treatments that temporarily change the levels of estrogen and progesterone in a woman's body. For example, women undergoing in vitro fertilization, that is IVF, they receive multiple rounds of hormone treatment to first suppress ovulation until the developing eggs are ready, then stimulate development of multiple eggs, and finally promote maturation of eggs. The use of hormones in some fertility treatments has raised concerns about possible increased risk of cancer, particularly cancers that are linked to elevated level of these hormones such as breast cancer. But many studies have examined possible associations between use of fertility drugs or IVF and the risk of breast cancer, and the bulk of the evidence is consistent that there is no increased risk of breast cancer associated with the use of fertility drugs or in vitro fertilization. So today we have covered pregnancy, estrogen and IVF.